So this is my dog Daisy. We're gonna do a quick adjustment with her, and then as far as her history goes, she was adopted through a animal rescue group, and she does have a pretty significant hip dysplasia on this right side. So our guess is that she's been hit by a car previously, but she does well with the adjustments. So we're gonna palpate her pelvis here. And so she's needs an adjustment on this side. And we'll do the other side. So with chiropractic, we're keeping everything within the normal range of motion of the joint, but we are adjusting any restrictions within that normal range of motion. So instead of a medical term of subluxation being outside the normal range of motion of the joint, we're gonna stay within that range of motion. So the chiropractic subluxation is actually the nerve, the muscle, and the bone causing problems within that local area. And so we're just gonna move up her lumbar spine here. Good job, Daisy. I know. And then we'll just real quick go through the thoracic spine. And so dogs usually don't cavitate like we do, and so most of the time we don't hear those loud pops like we do with people, because they are on four legs. Their forces are kind of spread out, whereas us, we have the compressive forces being on 2 legs. So I know you're fine. We're just gonna work our way through her neck here. And we could even adjust the jaw. And then the legs as well. So for the legs, we just kind of go through. So when they come and get an adjustment here, we try to do full body adjustments. And so, I know. Are we done? Good job. All right, and that's as easy as the adjustment can be.